survivor from insurance companies. How are
Yeah.
we going to sustain ourselves in this environment? And there's this shift. And those people that are shifting, I need you in the system to
Yeah.
provide. I really need you in the system.
So I see you angling toward that second part of the question beautifully now, as I'm hearing you talk about what do you anticipate for the future? What changes are you looking for? And I believe that I'm hearing you tell me about empowerment of individuals so that as your father prepared you for the 8 point check of your car, you're now not only treating the individual for the condition and the diagnosis that they came in, you're attempting to empower individuals for the lifespan, health span that they've got in the healthcare environment that they live in that may not include them. They may not
Yes,
have a road to travel on and they may need to
yes.
reroute to another road. Did I hear you correctly with that?
You heard me correctly because sometimes I tell folks, you know, that health ministry that you have in your church, make sure that health ministry is multidimensional. You need a
Mm,
dentist, a cardiologist, a general practitioner, a nutritionist, a physical therapist, an occupational therapist, a speech therapist, a certified health education specialist. That's
mhm.
what your health ministry should do for you and your
Right.
community. So when you go there, when there's a clinic, you can get seen and get what you need. If you're paying tithes to your church and your church is supposed to offer a community service, then that's what that health ministry service needs to look like. Because if you're underinsured for Medicaid or Medicare, you're not going to be able to go to a clinic. And so I think sometimes we at the community need to change how we
Mm.
provide health services. I see this in school systems too.
Jennifer, this is amazing what you're bringing to us, and it's well beyond what I had formulated in my mind for this question, because you're now talking about what has commonly been referred to as the third spaces in our lives. We talk about our homes and we talk about our workplaces and these third spaces in the forms of your community, your church now potentially supplying